You're welcome back. This is Breakfast Daily, and it is still Pink October, meaning that we are creating awareness for breast cancer. Now, we're going to go on to our health segment, and we're still talking breast cancer. But you would agree with me that, there are some kind of myths surrounding breast cancer. We are going to delve into that. So every question, everything you do not understand about breast cancer, I want to believe that will be captured this morning, because I have my own, I want to find answers to, i.e., so if you don't have a family history, can you get it? If you eat this particular food, are you at risk? We are going to settle everything here and now. And I've been joined in the studio by Dr. Kelvin. So, Doctor, you're welcome.
Thank you very much.
Right, so we're still talking breast cancer,
Yes, we are.
and our rag says it all. But I'm sure you are very familiar, with all the questions, all the myths that come with breast cancer and everything. I'm sure sometimes when you hear some, you laugh.
Yes, I mean, some of them are quite shocking. And interestingly, new myths they keep coming up. I don't know how they update the myths, but every so often you hear someone that you never heard before. So it's quite an interesting
Because we are reading all kinds of things, and, people are telling us all kinds of things.
It's true.
Breast cancer or cancers in general, are quite scary. So everything you hear, a couple of days ago, my skin was itching a little bit. So I just went on Google to check what causes skin itching, and I got all kinds of stuff. So some were like cancer. Then I was like, oh my God. I just had to now psych myself that, this is nothing. But let's go straight to the, maybe I can say the most common one.
Okay.
So for instance, if I don't have any family history, can I get breast cancer?
Yes, I mean, yes.
Oh, really?
In fact, majority of people who develop breast cancer have no known family history.
Majority?
Yes, majority.
Oh, no.
Yes, majority. So the fact that you don't have a family history does not mean you cannot develop breast cancer. You can still develop breast cancer, However, we know that those with family history have a higher risk of developing that breast cancer. So if your first degree relative, that's your mother, your sister, and even your brother or your father, if there's a history of breast cancer in any of these people, then your risk of developing it is about double what the general population faces. So you want to pay particular attention. But it does not mean that if you don't have any such relative, it does not mean that you are not likely to develop it. You should still pay attention to your breast, because you could develop it along the line. If you're looking at numbers, about 75% of people who develop cancer, they really had no family history.
Oh, that's such a shame, because I was looking at, so I can't see my family. I don't have anybody like that. Well, so now this is it. Exactly. So it settles it. So now, myth one, sorted. So now Okay, so let's go to the second one.
Okay.
If I'm eating well, if I'm exercising, if I maintain, my weight, if I limit alcohol, if I'm not smoking, can I get breast cancer?
Yes, you can.
Oh, so then what should we do?
Unfortunately, so the thing is, all the things you mentioned, or let me take it from this angle, they are all associations. So if you are overweight, if you are not eating properly, if you have a lot of your diet is bad, and you're not exercising, all these things automatically will lead to your being overweight or being obese. It leads to an increased risk of developing cancer. However, if you did everything right, it does not also mean that you will not develop cancer. It means what it shows that, or what happens, that your risk will reduce significantly if you were eating correctly. Because if you have a diet that is rich in micronutrients, such as fruits and vegetables, which also have antioxidants and all those other good things, it reduces the probability that you develop cancer. If you are not overweight, if your weight is healthy, if you're exercising, all these things improve your chances of not developing cancer, or even if you had the cancer, it helps you to deal with it better. Because your frame of mind is even good. Exercise actually works on your mind as well. And it helps you to actually deal with the cancer much better. So people who are healthy in terms of their diet, their weight, they don't develop cancer as frequently as those who are not. And even when they develop a cancer, the outcome is much better.
Okay, right. So let's go to the third one.
Okay.
So if I don't wear bras often, am I better, am I managing things better? Because sometimes, I don't know, apart from, holding you and making you appear firm, if I give myself some break from bra, at least for my bra to enjoy some breeze, is that a way of helping myself not getting bra, or has nothing to do with it?
It really does not. It has nothing to do with cancer. I mean, wearing a bra or not wearing a bra does not change the possibility or the probability of you developing cancer. In other words, it doesn't add or subtract anything.
Because sometimes we even go as far as to think that you don't have to wear the ones with the wire under
and all that.
And it doesn't mean anything.
It doesn't mean anything. I mean, previously some of the underwires or the material that the underwire was made from could react with your skin, so it might give you some rashes. And some people still experience that when they wear certain bras, they get rashes around the area where you know the material touched. You know, but all that is superficial. It's not going to cause cancer. So the presence or absence of bra does not change the outcome when it comes to cancer. Of course, braziers have their own issues, but we can talk about them another time.
But it's nothing to do with breast cancer.
But not with breast cancer.
And we're changing our bras just like that.
No, but you have to change the bra because, I mean, it's in contact with your skin. It's an undergarment. So, I mean, just as how you treat your underwear, your panty, you should also treat your...
No, even me, I'm talking about, you know, getting the right, so, you know, like the right bra. Because we did so with breast cancer in mind.
No, you see, you have to wear the right size of bra because it can help your... It can even help your physique.
Yeah.
You see, if your bra size is not the right size, it can cause you pain because, you know, especially if you are well endowed, the breast is weight, it's heavy. You know, so you sort of compensate for that weight by positioning yourself a certain way. And one of the proponents of wearing a bra is to actually help correct your posture.
Yeah.
So sometimes, well, I don't wear a bra, but I've spoken to people, and when they wear bra, yes, when they wear bra, they actually feel relief from back pain, especially people with a lot of you know, well endowed
because
bust.
it firms you up
Exactly.
properly.
You know, so the brassiere has its role to play, but that role is not in relation to breast cancer. So if you are talking specifically about breast cancer, then whether you choose to wear a bra or not, it doesn't matter.
Breast cancer doesn't care.
Yes, exactly. Breast cancer doesn't care.
Would certain kinds of underarm antiperspirants cause?
So again, this is a subject of controversy for a lot of people, but so far there's not been any direct link between use of antiperspirants or setting antiperspirants to cancer. You know, so for now, I mean, but of course I have to be careful to say it because I don't know all the types of what's it called, antiperspirants that are out there. So what you need to do is look for the active ingredients and then check if there's any specific information about this particular ingredient with respect to cancer. But so far, generally speaking, there's no linkage between most of the perspiring products and breast cancer.
No, so I'm just thinking of how we came about all these myths, you know, who started them anyway.
I mean, if you stretch it, I mean, it kind of makes sense to have that assumption because you see, when you put those, you know, those particular products on, you are not going to sweat over there. So the assumption would then be, where is the sweat going? So the sweat is probably going back in there to now develop into cancer. So, you know, to a lay person, you can't draw that association. And of course, when it comes to marketing, there are always those who are for and against. Because if I produce a deodorant that doesn't contain antiperspirant and you are coming in with something that can kick me out of business, I'll definitely have to find some way to put your product down. So I mean, it could be that's where it came from. We don't know.
Wow. No, but you also know that there've been calls, you know, that you shouldn't be picking your phones when you are charging them.
Yes.
When you have low battery, it's not advisable to use your mobile phones and all that. But some people actually put their phones in their bras. They put money in their bras. Are they at risk, you know, of getting breast cancer?
So, again, the use of mobile phone, there hasn't been any direct linkage between mobile phones and cancer in general, and more so to breast cancer. So whether I put it in your bra, you know, put it in your bra, there's no direct link. It does not mean, therefore, it does not mean, however, that you should continue putting your mobile phone in your bra. You see, because we don't know the link now, we don't know what's going to happen tomorrow. It's because the mobile phone is still a new product, you know, in the grand scheme of discussion. So we may not have found the association currently, but as time goes on, we could find it. You see, and so there are better places to put your mobile phone other than your brassiere. So don't put your mobile phone in your brassiere, and money as well, because money is dirty. So you're putting dirty things.
These days, you know, the system is some way, you know, safety, and also when you are just walking in a lonely place and you have your mobile phone in your hand, you may want to, put it at a safer place, and you want to hide it. So,
I understand.
Yeah.
You see, but the other aspect too is that the mobile phone does emit some radiation.
Yeah.
However, that radiation is not significant enough to cause any damage. As of now, we haven't found that linkage yet. But you have to put a lot of things in context, because your TV also generates radiation. Your microwave is generating some radiation. A lot of, there are telephone masts, there are satellite dishes all over the place.
People even live under transformers.
Exactly. So even though we may not have found an association on an individual basis, so if you pick the phone, there may not be an association. If you pick the TV, but when you put all of these together, it could be that they are generating enough to now cause problems. So you still want to be careful and avoid as much as possible if you can, so that if you don't have to put it in your brassiere, don't put it there. But say, as you described, you're working in a lonely place and that's the only place you can possibly keep it. Well, I guess we understand in that situation.
For a short time.
Exactly, but don't always go to lonely places too, so that you don't have to keep putting it in your brassiere.
Especially our mothers, at the market, they love doing that. The listing, they are putting them in their bra.
They work in the market, which means that they are going to be doing that all the time.
Exactly.
So that's then presents it could present a challenge, because if you are putting your mobile phone in your brassiere every single day, some of them go 7 days a week. That's a lot of exposure, and I don't think that is healthy.
Now, this particular myth that I'm going to talk about, now we are getting to know much more about it, but I want you to throw more light on it. Still, a lot of people think that only women can get breast cancer.
It's a perception that we are seriously trying to change, because men do get breast cancer, and I've said it here before that when a man actually gets breast cancer, the outcome tends to be more devastating.
Yeah.
You see, because as a man, we don't have significant breast tissue. I mean, the breast is just, for it's flat compared to the women. So there's not enough breast tissue. So should cancer develop in this small area, which also tends to be compressed, because the man naturally has more muscle than fat in the breast. So it's a small area. So the breast tissue is very small. So the cancer doesn't have room to even grow. So when it starts, before you can say Jack, it's already spreading. You see, and so the outcome tends to be more devastating. Statistically, about 1% of all the breast cancer cases happen in men. So you might think that 1% is not significant, but to the person who has developed a breast cancer, that's 100%. So it's significant to that individual. And having said that, if your family history, and we talked about family history earlier, if your family history, or the person who has actually developed the cancer in your family in your first degree is a man, your chance is actually significantly higher, because it means that obviously whatever gene or whatever issue is expressing itself as a cancer is significantly strong, because it has caused the male to actually develop the cancer. So then you as a female should pay particular attention to your breast, because it means that your risk is significantly higher. So yes, simply put, men do get breast cancer, so we should also be paying attention to our breast as well.
Interesting. So you can be part of the conversation by sending your comments and your questions to our WhatsApp line 0550 585832. Doctor is here, so if you have anything you want to ask about breast cancer, this is the time to do so. Now, is breast cancer contagious? If somebody has it, how close can I go?
It's not contagious. I mean, breast cancer does not spread by contact. It does not spread by cough. It does not spread by droplets. If you have it, you have it. If another person is going to develop it, it will not be because you had the breast cancer. There's no link. So you can shake hands with the person, you can hug the person. It's not going to come. You're not going to get it through that. It's not contagious at all. And so and this is important. In fact, this myth is important because a lot of times breast cancer patients get abandoned. I don't know if that's good English.
They're stigmatized.
Yes, they are stigmatized because the people fear that it's going to catch them as well. It's not going to catch anybody, from that person who has got it, However, because that person has got it, if that person is your close relative, it means that the probability or the possibility that the gene or the hereditary aspect is positive, and so you have to pay attention to yourself, because it could be in the blood, and you might also develop it later in life. So you might also want to take care of this person, so that when it's your turn, in quotes, somebody will take care of you. So, of course, having said that, advanced breast cancer, it can open up and become a sore, which has an offensive smell, you know, and it's quite repulsive. So we don't want to get there, you know, because when it gets to that level, there's not much we can do. It's probably spread fast. So even if you came to hospital, they will do what we call palliative treatment. You know, so we don't want it to get advanced where you have an open sore and with an offensive discharge and all of that.
Yeah. So now, if somebody in your family has had breast cancer, it doesn't necessarily mean that
you get
or
it.
nobody has got it. It doesn't necessarily mean that you will not get it. If you are overweight, or if you're managing your weight, if you are eating well, it doesn't necessarily mean that you're not going to get it. I mean, if you
but wait, when you put it like that,
everything means you're not going to get it. So where is this coming from?
When you put it like that, then it makes the situation seem a bit hopeless. It's not hopeless.
No, so what should we do? You know, because we are trying to manage your weight, it doesn't mean anything. Your family members don't have it, it doesn't mean anything. So what should we do? I mean,
you see, when we look at everything, it's all a numbers game.
Yeah.
You know, so even though we cannot say that if you have a healthy weight, you will not develop breast cancer. We cannot say that for sure. But if you look at the number of people who have developed breast cancer, and you look at their weight, majority of them are overweight or even obese.
Yeah.
You know, so then it tells you that there's an association between being obese and cancer. Because if you have a significant number of people who have cancer and they are all obese, and then those who have cancer and are not obese are a smaller number, then it means that let's shift towards healthy weight that can help prevent us from developing cancer.
Right.
You know?
Okay. Before you go on, there's a question coming from Miriam.
Okay.
A Latabia question. She's asking that wearing of bras for long hours, can this cause breast cancer?
No, it won't cause breast cancer. Now, I mentioned that
Nothing is causing breast cancer.
braziers have their own issues, and I mean, you probably need a whole show to discuss braziers. I don't want to go there because, but okay, for since the question has come up, now there's a theory that if you actually wear braziers,
you may want to answer this in 60 seconds because our time
yes,
is up here.
The theory is that if you wear braziers, it can cause your breast to sag earlier. You know, so
we've stopped wearing them. We have stopped wearing braziers.
And so they have their own issues, but it does not relate to breast cancer.
Okay.
So whether you wear it for long duration or short duration, it doesn't change your breast cancer profile.
So you may not get breast cancer, but you may have sagging breasts.
Exactly.
Right. I think I agree with you that we should have a whole conversation about bras. You know, it's very necessary. Doctor, thank you very much. But quickly give us your social media handles so that others can reach you on there as
you
well.
can find me on social media at Kelvin Owusu MD. So I'm active on all social media platforms.
Yes, and he's such a fitness guy, you know. So when you check him on social media, you see all the stuff he does, training and all. Thank you very much for coming.
Thank you.
This has been the health segment on Breakfast Daily. Now you know all the myths and facts about breast cancer. We'll be right back.